Good morning, students. Can you hear me? So, anyone is yet to join? Anyone is yet to join? Then shall I start the class now? Okay, so in the last class we were discussing about the health assessment, right? So, health assessment, it is a complete assessment of the body. So, here we have two steps. First step is health history and the second is physical examination. So in the last class we have completed the first step, that is the health history, and today we will discuss about the second step, that is the physical examination. Okay, so physical examination is a thorough inspection or a detailed study of the entire body or some part of the body to determine the general physical or mental conditions of the body. So physical examination means it's nothing but it's a inspection, means fully inspection of the body, means the detailed study of the body, that is called the physical examination. Okay, so here we have four methods of physical examination, means we have four different methods of doing physical examination. So first method is your inspection, second is palpation, third method is percussion, and the fourth is auscultation. So in the first method, that is inspection, means to see. Okay, we will see means and observe. So here visual examination of the body is called inspection. It is the observation with the naked eyes to determine the structure and functions of the body. So inspection means just observing. Okay, you will observe, um, you will observe the body. Okay, by observing you will determine the structure or the functions of the body. Okay, here the principles which you should follow while doing the inspection are: first is good lighting and exposure are essential, means good lighting so that we can observe properly. Okay, if there is not enough lighting, then we won't be observe everything, so that's why you need a good lighting. Inspect each area for shape, size, color, symmetry, and position, and find out any deviation from normal. So inspect each area for, like suppose eyes. For eyes, we have to observe everything, the its size, its shape, and its color. If it's symmetrical or not, everything we have to observe, so that we can find out if there is any abnormalities. Okay. Then the third point is, if necessary, we can also use additional lights for examining the body cavities, like for for observing oral cavities, we have to use the additional lights for examining it properly. Then the next is use sense of olfaction along with visual to detect abnormalities. Example, bad breath, smell, unhygienic mouth conditions. Acidotic smell is significant of diabetic acidosis. So these are the points which you should remember while doing inspection. Clear? Inspection means to just to see and find out, just to see and assess the body. That is inspection. Okay, then the second point is palpation, means to feel. Clear with the inspection? Okay. So palpation means we will feel it. We will feel and observe. We will feel and know. Okay. So here it is the feeling of the body or a part with the hands to note the size and position of the organs. In palpation, the finger pads is used and not the fingertips. A light or deep palpation depends on the area of being palpated. The palmar surface of fingers and finger pads are used to determine position of the organ, size and consistency, fluid accumulation, pain and masses. The ulnar surface of the hand is used to distinguish vibration and temperature. The moisture and warmth of the skin also can also be determined during palpation. So palpation means what you will do? You will place your palmar surface of the hands on the body and feel it. Okay, so here we have two types of palpation. First is light palpation and the deep palpation. Okay, And light palpation or deep palpation depends on the area being palpated. So here is the palpation. The first picture, that one is light palpation. In the light palpation, what you will do, you will just press your finger, your hand for 1 centimeter, okay? And in deep palpation, you will press your hand for like 2 to 2.5 centimeter, okay? Means you will place your palmar surface of the hand on top of the body and you will feel it, okay? That is the palpation. And here we have two types, light and deep palpation. Clear? And while doing palpation, you have to always use your finger pads, not the fingertips, okay? You won't do the palpation with the fingertips, but you will just do with the finger pads. And following points are to be kept in mind while doing palpation. First is the client should be relaxed and comfortable. Observe non-verbal signs of discomfort during palpation. Second is palpation should be done with warm hands, short fingernails, and a gentle approach. So while doing palpation, you have to always you have to make sure that your hands are warm. Okay, you won't do palpation with your cold hands. So before doing palpation, what you will do, you will rub your hands, the palmar surface against each other, so that it becomes warm. Okay, then palpation can be to be done slowly and gently. Then for light palpation, the hand is depressed about 1 centimeter, yes, which I have already said. And for deeper palpation, it should be approximately 2.5 centimeter. So this was all about the palpation. Clear with the palpation? Okay, inspection means to see. Okay, palpation means to feel. That is that is palpation. Then the percussion. Percussion means it is the examination of the body by tapping with the fingers on the body to determine the condition of the internal organs by the sounds that are produced. It is done by placing a finger of the left hand firmly against a part to be examined and tapping with the fingertips of the right hand. So here what you will do, you will tap on top on the body. Okay, while tapping, the sounds which produce while tapping, through that sound we will determine the condition of the body. Okay, that is percussion. So I'm going to repeat once again. Percussion means you will tap on top of the body, and while and the sounds produced while tapping, by that sound you will determine the condition of the body. Okay, so how you do the percussion, here it is. Please mute yourself. Whose voice is this? Is it Jebina Parvin or of that music? Jebina? Jebina, are you there? Yes, please tell her to off the music now. Yes. But now it's okay, I think. I'll continue here only. Next class I'll do in the web. Okay? Yes, yes. So, okay. So here in the methods of percussion, here we have two methods, direct and indirect percussion. Okay, so in the direct percussion, what you will do, you will just strike the body surface directly with 1 or 2 fingers. Means you will just strike it directly. And in the indirect percussion, what you will do, placing the middle finger of the non-dominant hand firmly against the body's surface and striking the distal joint of non-dominant finger with the middle finger of the dominant hand. So here is the picture of the indirect percussion. So you will place your one hand on top of the body. After that, using your another hand, you will tap on the middle finger. Okay, this is the indirect percussion. So clear. Direct means you will just tap on the surface of the body, and indirect means you will use both the hands. Okay, this is about the percussion. And while tapping your body surface, the sound which you produce, the sound which is produced, by that sound you will be able to determine the condition of the internal organs. Then comes the, yes, these are the characteristics of sound produced: resonance, hyperresonance, tympani, dull, and flat. So here auscultation. So auscultation means it is listening to sounds within the body with the help of stethoscope, phaetoscope, or directly with the ear placed on the body. So this is the auscultation, means you will hear to the, you will listen to the sounds by using the help of stethoscope or the phaetoscope or directly with the ear placed on the body. So this is the auscultation. So here, so the methods of palpation, we have four methods: inspection, palpation, percussion, and auscultation. So I have explained all the four methods. First, inspection means to just see and know, just see and understand about the condition of the body structure. Then palpation means you will feel it, you will feel and understand the condition. And the percussion means you will tap it, you will tap it, and the sounds produced while tapping, with that sound you will understand the condition of the body. Then auscultation means you will listen to the sounds with the help of stethoscope. That is the auscultation. So all are clear with these four methods of physical examination. Okay. So indications of physical examination means when you will do physical examination. So first you will do at the time of the admission, then before or after any diagnostic or therapeutic procedures, or at the time of the discharge, or as a follow-up, or any during any health camp. So these are the indications for physical examination. So here are the steps of physical examination. So articles required means what articles are necessary while doing physical examination. So first you will need draw sheet for draping the patient. So draw sheet means like it's a bed sheet. Okay, why it is necessary? To drape the patient, so that to cover the patient, to provide privacy. Then the second is measuring tape or stadiometer for measuring height. Next is weighing machine. Next is TPR tray. TPR tray means temperature, pulse, and respiration tray. Okay, so here for checking the temperature, pulse, and respiration. Then stethoscope, then Snellen chart and Rosenbaum chart for checking the visual acuity. So for checking the visual acuity, we have this Snellen chart and Rosenbaum chart. So here is the picture of the Snellen chart. Then next is reflex hammer. So here you can see the picture, reflex hammer for checking the reflexes. Then tuning fork, here is the tuning fork. Then color paper to for checking the color discrimination. Then pen tool, scale, history taking chart, then sample bottles, then cotton swab sticks. So all these are the required articles while doing physical examination. So here procedure. Okay, so procedure of doing physical examination. First, what you will do, you will prepare the patient. Okay, prepare the patient mentally and physically. So physical preparation includes you have to maintain privacy. So for maintaining privacy only, we need all those draw sheet and all. Then empty bowel and bladder, loose clothing, appropriate draping, maintain comfortable environment, good lighting, adequate temperature, appropriate and comfortable position. So these are your physical preparation. Means you have to do all this preparation with your patient. Okay, then for mental preparation, what you will do? You will explain the procedure to the patient. Okay, so now comes the steps. Starting. So physical examination means it is also known as head to toe examination. Okay, means as it is a complete assessment of your body, what you will do, you will assess the body from head to the toe. Okay, that is the physical examination. So first step is, so are you all clear till here? I'll start with the procedure now. Am I audible? So I'll start with the procedure. Okay, so procedure first, what you will do? General examination. Okay, and while doing physical examination, you will get a one format. Okay, you will write according to this format. So first, you will ask the patient his name, age, and sex. Okay, after that, you will see the nourishment, well nourished or undernourished. Next, you will see the body build. So in the body build, what you will write? Ectomorph, endomorph, and mesomorph and endomorph. So ectomorph means the person who is lean and thin. Okay, if the person is lean and thin, then you will write it as an ectomorph. And if the person is of medium weight, then you will write as mesomorph. And if the person is of healthy, means like overweight more than medium, then you will write it as endomorphic. Then consciousness, you will write conscious, unconscious, or semi-conscious. Then orientation, you will write oriented or not oriented. So for checking the orientation, you will ask the patient about like uh, time, place, and person. At what time is this? Like which, where are you, or who is this person? So you will ask all these questions. If the patient can answer all these questions correctly, then the person, then it will you will write it as oriented. If he can't answer, then you will write it as not oriented. Then temperature you will check, then pulse, respiration, then blood pressure, and fluid intake and output. Intake means the amounts of fluid he is taking, okay, including all the IV infusions or fluid, everything. Then output means his the amount of urine he is passing. Okay, that is the output. Then you will take the weight and height. So and then you will see the self care, dependent, independent, and partially dependent. So dependent means like someone is doing all the self care activities for the patient. Okay, and independent means the patient can do all the self care activities by himself. Then dependent, partially dependent means like someone is helping her. But dependent and partially dependent, there is a difference. Dependent means complete dependent. Okay, partially means like some care she can do by herself and some care are done by the other family members. Then generalized edema, you will see edema means like accumulation of fluid. Okay, accumulation of fluid in the body. So if there is edema, then what will happen? There will be a swelling in the patient's body. So if there is swelling in the whole body, then you will write it as yes. If no, then you will tick the no option. Then skin integrity will check normal or impaired, then presence of jaundice or cyanosis. Jaundice means like if there is jaundice, then the patient will appear yellow in color, and if there is cyanosis, then the patient there will be bluish discoloration of the patient's skin. Okay, why there is bluish discoloration? Because of the lack of oxygen in the patient's body. So this was all about your general examination. Now comes to the head. Okay, so in the head, first you will observe the color of the hair. You will write if it's black, then black, brown, or any color, whatever you observe. Then distribution of hair, you will write equally distributed or not equally distributed. Then skull circumference. So skull circumference you have to measure using the measuring tape. Okay, so how you will measure the skull circumference? Uh, Now it's not possible to show you how to measure, okay? In the online it's not possible. So I will share you some videos, YouTube videos. So from those videos you can see and learn. In scalp you'll see if it's clean then clean. If it's not clean then you'll write it as neglected. Okay, then appearance you will see round bulbs or visible blood vessels. Then after the head comes the face. Okay, so face you will write, you will see first shape of the face like round, oval or moon shape. So here there is a picture of the moon shape. Okay, if the face is like chubby type, then it will be a moon face. Then symmetry, asymmetrical or symmetrical, you will see. Then involuntary movements you will see present or absent. Like involuntary means any unnecessary movements. Okay, if there is any unnecessary extra movements in the face, then you will write it as present. If there is no movements, then you will write it as absent. Okay, this was all about the face, and comes the eyes. So eyes you will see first eyebrows, normal, abnormal. Then eyelids you will see normal, swollen, drooping, and ectropion or entropion. Entropion. Okay. So normal means normal, swollen means like swollen, drooping means like your eyelids, the upper eyelids falls. Okay, that is drooping. Then ectropion and entropion, here is the picture here. Entropion means your eyelid will turn inward. Okay, and ectropion means eyelid will turn outward. So all this you will see and you will tick the correct option. Then you will see the eyeballs sunken or protruded. Sunken means like the eyeballs turn inward. Okay, then protruded means like eyeballs will turn outward, round. Means like big type of big eyeballs. Then conjunctiva you will see if it's red, pale or purulent. Then sclera you will see white, gray, yellowish, all these colors you will see and tick the right option. Okay, and cornea and iris you will see. Then pupils you will see dilated, constricted and reactive to light. So for checking the pupils what you will need a pen torch. Okay. So using the pen torch you will check the pupils. Then the next you will see lens, opaque or transparent. Then next you will see vision, normal, myopia or hypermetropia. So myopia means those person who is not who can see the near objects clearly but not the far objects. Okay. Then the hypermetropia means those patient who can see the far objects clearly but not the near objects. So all this you will assess and tick the correct option. If there is no any abnormalities, then you will write it as normal. Then color discrimination you will see and you will tick the normal or impaired. Okay, this was all about your eyes. Then comes to the ears. So ears, first you will observe the external ears, normal or abnormal. Second, you will see the tympanic membrane. So here you will see perforation, lacings or bulging. Then hearing acuity you will see normal or impaired. Then if any hearing loss you will see conductive hearing loss or sensory neural hearing loss. Then if any discharge you will see, if there is discharge then you will have to write the color and order of the discharge. So how to check the hearing acuity, how to check the hearing loss? So for checking the hearing loss you have two tests. Okay, Weber test and Rhine test. So for Weber test what you will do, yes, and for checking the hearing loss you need a tuning fork. Okay, tuning fork is necessary. So here what you will do, you will strike the tuning fork and put it in the forehead. Okay, and you will ask the patient if he can hear the vibration equally in both sides of the ear or not. Okay, that is Weber test. And if the after that if the person can hear the vibration only in the one side of the ear, okay, then means the person's hearing is affected. Okay, it might be either conductive hearing loss or sensory neural hearing loss. So for confirming if it's conductive hearing loss or sensory neural hearing loss you have to do a Rhine test. Okay, so for Rhine test what you will do, you will strike the tuning fork and put it in the mastoid bone. Okay, mastoid bone is present behind your ear, okay. So after putting it in the mastoid bone what you will do, you will ask the patient, you will ask the patient to you will ask the patient to feel the vibration. Okay, you will ask the patient to feel the vibration. After that, once he stop feeling the vibration in the mastoid bone, you will bring the tuning fork to nearby his ear. Okay, nearby his ear. After that, if the person is able to hear the vibration after bringing nearby his ear, then what it means that it is a normal or it is a sensory neural hearing loss. Okay, if the person is not able to hear the vibration uh, after bringing nearby his ear, that means it is not normal, means it is conductive hearing loss. Okay, air conduction if it's greater than bone conduction, that means it's sensory neural hearing loss. If its bone conduction is greater than uh, Air conduction, that means conductive hearing loss. So this one I will share you the videos, okay, how to conduct Weber test and Ryan test. I will share you some YouTube videos, so you watch the videos and you will understand it clear. Then you will see the nose. So a nose, here what you will observe, septum normal or deviated. So here is the picture of the normal and deviated septum. Normal means the septum will be straight and the deviated means it will be crooked. Okay, appearance you will see pale, congestive or polyp. Polyp means like some extra tissue. Then discharge of the nose, you see if there is discharge then you will write it yes, and you will see the color and odor of the discharge, and pain on palpation of the sinuses. So you will palpate the sinuses, if there is pain then you will write this yes, if no then you will mark the no. Then next comes the oral cavity. So oral cavity, what you will write, first what you will see, first you will see the teeth, if it's clean then clean, if it's not clean then you will tick the coated. Then dentures, dentures means like those mm, artificial teeth. Okay, artificial teeth is called dentures. So if there is artificial teeth then you will write it is present, if there is no any artificial teeth then you will write it as absent. Then you will see the tongue, then you will see the lips, then after that odor of the mouth, and if there is any ulcers or lesion present you will see all this. Okay, after that you will tick the correct option. Then for the neck, what you will do, for the neck first you will see the appearance, swollen, normal or presence of any dilated neck vein or visible carotid. Okay, after that you will see the lymph nodes. Lymph nodes you will see if it's palpable or not palpable, and then thyroid gland you will see. Can you hear me? Hello? I think from this from neck we will discuss in the next class. Okay, so uh, till oral cavity you have understood. Clear? Okay, so in the next class, I'll continue from the neck part. Okay, so now all of you write it down and give me your attendance. Okay, you have any doubt, any question till oral cavity? Okay, if you have any doubt, then you please ask. Okay, so in the next class, I'll continue from the neck. So all of you, one of you, give me the attendance in the WhatsApp group. Okay, so now you can leave the class.